Hello viewers, welcome to our detailed exploration of the changes in UK visa application fees in 2024. This year, the UK has introduced significant adjustments to its visa fee structure, affecting various categories including student visas, dependent visas, health and care worker visas, visitor visas, and skilled worker visas. So, whether you're a student looking to study in the UK, a skilled worker, someone on a dependent visa, or even a visitor, then this video is for you. Hence, make sure you watch till the end of the video, so you do not miss out on this very vital information. For those new to the family, please do not forget to like, share and subscribe to the channel. Otherwise, let's get into it. 1.0. Student visa fees. Student visas in the UK are essential for international students who wish to study in the country. The fees for these visas have seen an increase in recent years. 1.1. Student visa application fees. As of October 2023, the fee for a student visa application is £490, regardless of whether the application is made inside or outside the UK. This fee applies to both the main applicant and any dependents. 1.2. Immigration Health Surcharge, IHS. In addition to the application fee, every student must pay the Immigration Health Surcharge, IHS, for each year of their stay in the UK. The IHS is set to rise significantly from £624 to £1,035 per year, starting January 2024. This surcharge is mandatory for most visa applicants, and is usually payable alongside the application fee. It is charged per year of permission requested, and its payment enables migrants to gain access to the National Health Service in the UK. 1.3. Impact of the fee increase. This hike in the IHS, coupled with the visa fee, represents a considerable increase in the overall cost for international students planning to study in the UK. It's important for applicants to check the latest fees at the time of their application. The increase in fees in the IHS will affect not only the students, but also their dependents, making it more expensive for them to study and live in the UK. 2.0. Dependent visa fees. Dependent visas in the UK are designed for family members of those working or studying in the country. The fees for these visas vary depending on the type of dependent visa and where the application is made. 2.1. Spouse visa fees. For those applying for a spouse visa, the application fee in 2024 is £1,048 if the application is made inside the UK and £1,846 if made outside the UK. In addition to the application fee, there is an Immigration Health Surcharge, IHS, of £1,035 per year. There may also be additional costs for optional premium services such as expedited processing or assistance at a visa application center. 2.2. Student dependent visa fees. For dependents of students, the visa fee is £490 per person. The IHS for these dependents will also be £1,035 per year. 2.3. Dependent children fees. If dependent children are being brought to the UK, the application fee for each dependent is the same as the main applicant. This means the full visa fee and IHS for each child will need to be paid. 2.4. Impact of the visa fee and IHS increase. These changes in visa fees and the IHS will affect family members of those working or studying in the UK, making it more expensive for them to join their loved ones. It's important for applicants to check the latest fees at the time of application, as they are subject to change. 3.0. Health and care worker visa fees. The health and care worker visa is a special category that allows medical professionals such as nurses, nursing support workers, and doctors to work in the UK, primarily within the NHS or the independent healthcare sector. In 2024, the visa fees for this category have been set at £284 for a visa lasting up to 3 years, and £551 for a visa lasting more than 3 years per applicant. 3.1. Visa fee structure. The cost structure for the health and care worker visa is designed to be more affordable, compared to other visa categories, reflecting the UK's need for healthcare professionals. The fees are as follows. For a visa lasting up to 3 years, £284 per applicant. For a visa lasting more than 3 years, £551 per applicant. 3.2. Immigration Health Surcharge Exemption. One of the significant benefits for health and care worker visa holders and their dependents is the exemption from the Immigration Health Surcharge, IHS. This exemption means that applicants in this category, as well as their dependents, do not have to pay the IHS, which has increased to £1,035 per year for most other visa categories. The IHS exemption represents a considerable saving, especially for those coming to the UK for longer periods. 3.3. Impact of the visa fee and IHS exemption. The relatively lower visa fees and the IHS exemption make the health and care worker visa an attractive option for eligible healthcare professionals. This is particularly important given the critical role these workers play in supporting the UK's healthcare system. The exemption from the IHS is a recognition of their contribution and an incentive to encourage healthcare professionals to work in the UK. 3.4. Planning ahead. Applicants for the health and care worker visa should ensure they are aware of the latest fees and regulations at the time of their application, as immigration policies and fees are subject to change. It is advisable to check the official UK government websites for the most up-to-date information before applying. The health and care worker visa fees for 2024, along with the IHS exemption, provide a more accessible pathway for healthcare professionals to work in the UK. These measures are part of the UK's strategy to attract and retain essential healthcare workers, ensuring the resilience and sustainability of the healthcare sector. Applicants should take advantage of the lower fees and the IHS exemption, which significantly reduce the financial burden of moving to and working in the UK. 4.0. Visitor visa fees. The UK government has introduced new visa fees and regulations that will come into effect by the end of 2024. One of the significant changes is the introduction of the Electronic Travel Authorization (ETA) fee. The ETA is a digital permission to travel to the UK, and it costs £10 per applicant. This fee applies to every traveller, including children and babies, and the ETA is valid for 2 years. The ETA scheme is primarily for visitors who do not need a visa for short stays in the UK. It allows multiple entries into the UK within the validity period. The ETA is electronically linked to the applicant's passport, and travelers will need to apply for a new ETA if they get a new passport. The ETA scheme was initially open for Qatari nationals, and will be introduced for nationals of Bahrain, Kuwait, Oman, Saudi Arabia, and the United Arab Emirates from February 1, 2024. The scheme will become mandatory for all other non-visa nationals before the end of 2024. In addition to the ETA fee, the cost for a visit visa for less than 6 months is rising by £15 to £115. A 5-year work visa will cost around £9,000 in 2024, and a 2.5-year partner visa will be around £5,000. These changes are part of the UK government's plan to transform and digitize the UK border, improve travel, and strengthen the security of the border. 5.0. Skilled worker visa fees. The skilled worker visa category has seen a significant increase in application fees in 2024. The standard application fee now ranges from £719 to £1,500, depending on the duration of the visa, and whether the application is made from inside or outside the UK. For instance, if you're applying from inside the UK to extend, switch or update your visa, the standard fee is £827 for up to 3 years, and £1,500 for more than 3 years. In addition to the application fee, the Immigration Health Surcharge, IHS, has also seen a substantial increase. As of 16th of January 2024, the IHS has risen by 66% from £624 per year to £1,035 per year. This increase applies to all visa categories, including the skilled worker visa. The IHS is payable upfront for the entire duration of the visa. For example, a skilled worker applying for a 3-year visa would previously pay an application fee of £827 and an IHS of £1,872. After the changes in 2024, the IHS for the same 3-year period will increase to £3,105, bringing the total cost for the applicant to £3,932. Moreover, the UK government has also increased the minimum salary threshold for sponsorship under the skilled worker route. The baseline minimum salary has risen from £26,200 to £38,700. This increase, coupled with the rise in visa and IHS fees, represents a significant change in the overall cost and requirements for skilled workers planning to work in the UK. These changes will have a substantial impact on the overall cost of skilled worker sponsorship. It's important to note that while the visa application fee and the IHS are typically the responsibility of the migrant, many employers choose to cover these costs as part of relocation packages. However, the increased costs may affect the ability of some employers to do so, potentially impacting the number of skilled workers able to come to the UK. In conclusion, the changes in UK visa application fees in 2024 are extensive, and will have a considerable impact on applicants across various visa categories. It's essential for potential applicants to be aware of these changes, and plan their finances accordingly. For the most accurate and up-to-date information, always refer to the official UK government websites, or consult with immigration professionals. Not so fast though. Did you like the video? Do you have friends and family that need to know about these details, to make their move to the UK a success? Then make sure you share. Many of you only watch my videos, but haven't subscribed. Why not? Please subscribe today, and turn on the notification button so that you be the first to be notified when I drop more of this content. Otherwise, have a good end to the year. Shalom.